like how can teachers be trained to identify the warning signs of suicide risk
Okay.
in students and accordingly provide appropriate referrals and solutions?
Yes, I think it's very important question, and there are 4 or 5 evidence-based methods of preventing suicide. For example, uh, providing services in program-based manner is one of them. So you provide service as usual. Against you develop a state program or district program or national program and provide service through that. It has been found that the services which are provided in form of a national or state or an administrative program are better to in terms of their efficacy. Similarly, when you use antidepressants for prevention of suicide, even that has been found in the same manner. Teachers training program has a very high credibility for its effectiveness. And there are a number of reasons for that. And it is an important component. There is a book which has been published last month, which is a course book for teachers training program. And it is called Handle Life with Care. I will be briefing you, but if you go on Amazon, you can purchase that book. It has the full compilation about the question that you are asking. WHO has been coming out with number of documents for last 10 years. How teachers should be trained, what should be the content, and how do we train them in warning signs, etc. But our problem is not that. When we started this program, our first focus was to connect with teachers. But teachers in India are very unique. Unique in the sense they are multi-purpose government workers. So what they do, they carry out elections, they carry out everything that a government wants to do, any administrative job, and their focus for teaching is now limited to multiple times doing biofeedback, biometry that they are present. Then when I talk to them, they say that, well, there is, I'll give you an anecdote to see, it will explain you. Back in 1997, we did same kind of experiment with University of Mumbai. Mumbai University has 114 colleges. So then Vice Chancellor was a pediatric surgeon, Professor Deshmukh. When I requested, she called a meeting. And from morning till evening, we were about 16 speakers from various disciplines, from police, from law, from government, from psychiatry, general practice, medicine, emergency room, etc., etc. At the end of that, at the end of the session, we made an announcement and request that now we will conduct 2 weeks training program. Now listen carefully, it's a very unique training program I'm talking about. 2 week training program, and we request the colleges to depute one teacher. Out of 114, 15 colleges agreed to depute. And what we had done, those days there were 4 medical colleges in Mumbai. They all were participating. So morning, a senior resident used to take 3 or 4 teachers to casualty, emergency room, ICU, psychiatric ward, meet the resident there, meet social workers, psychiatrists. Idea was to give them an exposure. What exactly happens when a person attempts suicide and he comes to the hospital? How is he treated? What are the dynamics involved? What goes on when they are referred to Department of Psychiatry? And what happens when they are going out to their house? What are the issues? So from 9 o'clock to 12 o'clock, 3 hours, they would spend with a dedicated resident. After lunch, they would get together in Mumbai University in a hall, and every day one professor used to visit to talk to them for 3 hours. That was the training program. We published a booklet and gave 400 copies to Mumbai University. This is 1997. And at the end of that, we did the evaluation of teachers. I think we presented the data in APA and a couple of conferences those days. I don't remember, but because the sample size was very small, I could not really publish that. But the dominant finding was that when you ask them, do you think this student suicide is your problem? That 87% said, no, 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 it's not my problem. It is a problem of parents. Majority of them said, hame kya karna? Now, I'm talking about 2023 now. When we started this, I had interaction with the number of people. So I quote, I sent the request to one of the management university in India, okay? And the director said, we have no problem like suicide, so we are not interested in conducting this program. So जैसे कि मैंने शुरू में कहा था कि हमारी मानसिकता ये है कि ये समस्या बरसात का वो पानी है जो सबके घर में जा सकता है मगर मेरे घर में नहीं आएगा. There is so much of denial. It is not only the question of awareness. So when I talked to people in Kota, we conducted a program there and I had some conversation. The issue is if a tuition institute does something to deal with mental health, the perception going into community is that, well, probably after they come to your institution, the mental health problem crop up. That is why you are trying to cover up. So they don't want to be stigmatized. They don't want to get bad name. They don't want to. The welfare is not the agenda. Agenda is very different. So our students are facing complex challenges. Unless now I have told that about 6 months back, there was a Supreme Court directive and IIT Chennai, number of students were given the privilege of mental health assessment. We'll talk about it. So the problem is not the teaching program. You can teach them, train them, you can, but the question is whether they are willing to take it, whether they are willing to implement it, whether they are stigmatized. Are they bold enough to say no? Half of the students are feeling stressed and teachers must do something. The agenda of education must change. The issue is not education and mental health education. The purpose of education is at question. What is at stake is the very objective. Why do we provide education? Is it the employment? Is it the character building, personality building, providing options, becoming a good citizen, becoming a good soldier, good doctor, good engineer? That's the issue. Is that the governments will have to open the debate. Why do you want to educate? How much and what kind of citizens you want? Because as so look here, so success. Students want to become successful, right? Everybody wants to become. Now, what happens after success? During 10 years, the top-class, top-notch successful person, during 10 years, this I'm quoting SOCM research in India and many in management organization in America. The findings are same with little bit of variation. 42% of most successful people develop mental health issues and fall out and lose their success in 10 years period. And the prime cause is bipolar depression, separation, divorce, economic drain, and number of stress-related disorders. We are into the business. See, when मैं ये कहता हूं कि when the question comes, why should a student consult a psychiatrist? You're doing a psychiatric training, right? Why? My answer to them is very different. What do I say? That I have got 7-8 rooms in my house. In only one room, I keep people who are too sick. They are patients. But in the next room, I have their relatives, their loved one. उनके प्रियजनों से मेरी बात होती है. लेकिन बाकी की जो कमरे हैं, उसमें सभी आते जाते हैं. हर शख्स रहता है. Mental health is for 100% people. Mentally ill are hardly 10% who need treatment. So therefore, we are not only, it is another unfortunate thing, the message which is going to the community, that psychiatrists are people for sick people. They treat patients, they treat mentally ill, downtrodden, those who are dysfunctional, जिनका कुछ नहीं हो सकता, दुनिया से बेकार लोग हैं. I'm not talking that we are not into that business. Sorry, we are in the business of reconstruction of life. We are in the business of restoration of loss. We are in the business of restoring sanity of mind. Until and unless your education system conveys unequivocally who you are not going to be able to deal with people of the country. They have questioned. The moment you say, but मुझे बीमारी नहीं, मैं क्यों आपसे बात करूं? बात तो सही है. Why should they talk to me? If somebody is not depressed, why should they talk to me? But I'm saying you must talk to me because I will find out the hidden potential that you have. I will find out how best you use your intelligence, and I will tell you how to be more creative in your relationship. I will tell you how not to spoil your marriage. I will tell you how not to borrow money when you are depressed. This is what is mental health and psychiatry. I think we need a lot of innovation and revolution in the field if we have to really make some difference in this subject. That's the way our young generation should think. You guys are not the people for mentally ill. This is the difficulty. And imagine most of us, if India has about 6,000, say sometime back it was 4,000, now it is 6,000 psychiatrists. Do you know that 70% of our mental health professionals are trained in institutions where people are lodged, they are dealing with chronically ill people. They have never seen a issue of marital separation in a young person who is not mentally ill. How will you see? If you're not trained in the community, if you're not dealing with people, do you imagine a person going through a separation in life will come to a mental health institution and talk to you? Why am I going through that? So if you are training your manpower for mentally ill people, God bless you, you will continue to deal with them. But if you want to work for mental well-being, mental health, psychological health, you have to change. And it's time to change. There is no denial. We need new courses for doctors. We need new courses for psychology. We need new courses for humanities. We need new educational material. We need new educational style and new methods and method of testing the effectiveness. It is not working out. Why are we struggling for stigma? Why don't we question that probably the instruments we use to eradicate stigma is useless? पुराने नुस्खे चल ही नहीं रहे हैं. हमें नए दवाइयों की, नए तरीकों की तलाश है, और वे सारे नए तरीके नए लोगों से ही आएंगे. It is a challenge for you doctors. Okay, I think any more question?